Welcome to our channel. Today we're diving into an important topic that affects many women: hormonal imbalances. You know, we often think of hormones as these mysterious things, but they actually play such a crucial role in our overall health. And when they're out of whack, it can manifest in some really surprising ways. We're going to explore 9 common symptoms you should be aware of. Just like when I'm examining a patient's skin, it's all about recognizing the signs and knowing when to take action. Remember, knowledge is power, and the more you understand about your body, the better equipped you'll be to advocate for your own well-being. So let's get started and uncover those telltale signs that your hormones might need a little TLC. Let's explore the 9 common symptoms you should be aware of.
Have you ever noticed dark patches on your skin, especially on your face? It's something I see quite often in my practice, and it can be a sign of hormonal changes. You see, when your estrogen levels fluctuate, especially during pregnancy, or if you're taking birth control pills, it can trigger an increase in melanin production. Melanin is what gives our skin its color, and sometimes those hormone fluctuations can cause it to go into overdrive, resulting in hyperpigmentation. These patches are usually harmless, but I know they can be a cosmetic concern for many women. Now, if you've been using birth control pills for an extended period, it's possible to develop a condition called melasma. Melasma is basically hyperpigmentation that's triggered by, you guessed it, those hormonal changes caused by the pill. It often shows up as brown or grayish-brown patches on the face, particularly on the cheeks, forehead, and upper lip. The good news is that melasma often fades on its own after pregnancy or when you discontinue hormonal birth control. However, if it's bothering you, there are treatments available, like topical creams, chemical peels, or laser therapy. It's always best to consult with a dermatologist to figure out the best approach for your specific situation. Skin tags are those tiny, soft skin-colored growths that tend to pop up in areas where your skin rubs together, like your armpits, neck, or groin. They're super common and generally harmless. But did you know they can also be related to hormones? It's true. Hormonal fluctuations, especially during pregnancy or menopause, can cause skin tags to develop or become more prominent. Think of it like this. Your skin is kind of like a delicate ecosystem, and when your hormones are in flux, it can throw things out of balance. During pregnancy, for example, your body is flooded with hormones like estrogen and progesterone, which can stimulate skin cell growth and lead to the formation of skin tags. And then, during menopause, as estrogen levels decline, skin tags can also make an appearance. Now, I know some people find skin tags bothersome, but they're usually nothing to worry about. However, if they're getting irritated, bleeding, or you just don't like the way they look, it's easy to have them removed. A dermatologist can quickly snip them off or freeze them with liquid nitrogen.
Okay, let's talk about something that can be a bit embarrassing for some women: excessive body hair growth, or hirsutism. We're talking about coarse, dark hair that pops up in places where women typically don't have it, like the face, chest, and back. Now, we all have hormones called androgens, including testosterone, even us ladies. But when those androgen levels are higher than usual, it can lead to this unwanted hair growth. It's like your body is getting its signals crossed. There are a few things that can cause elevated androgens in women. One of the most common is a condition called polycystic ovary syndrome, or PCOS. PCOS messes with your hormone balance and can lead to a whole bunch of symptoms, including hirsutism. Another culprit could be high cortisol levels, which can happen if you're dealing with chronic stress or a condition like Cushing's syndrome. Cortisol is our stress hormone, and when it's constantly elevated, it can throw your other hormones out of whack.
Acne. It's the bane of many people's existence, especially during those teenage years. But did you know that hormonal fluctuations can also trigger breakouts, even in adults? It all comes down to those pesky androgens again. When your androgen levels surge, it can cause your skin's oil glands to go into overdrive, producing excess sebum. And sebum, my friends, is like a magnet for dirt, bacteria, and dead skin cells, which can clog your pores and lead to inflammation. That's when those red, angry pimples rear their ugly heads. Hormonal acne often pops up on the face, chest, and back, and it can be particularly troublesome for women during certain times of the month, like right before their period or during pregnancy. Those hormonal shifts can really wreak havoc on your skin.
Okay, we've talked about unwanted hair growth, but what about hair loss? It's a common concern for both men and women. And you guessed it, Hormones can play a major role. You see, our hair follicles are pretty sensitive to changes in hormone levels, especially estrogen, testosterone, insulin, and thyroid hormones. When these hormones are out of balance, it can disrupt the hair growth cycle and lead to thinning hair or even hair loss. For example, elevated testosterone levels, which can convert to a hormone called DHT, can actually shrink hair follicles and inhibit hair growth. This is a common cause of female pattern hair loss, where hair thins gradually on the top of the head. But it's not just about androgens. Thyroid imbalances, such as hypothyroidism or hyperthyroidism, can also disrupt hair growth. And insulin resistance, which is often linked to weight gain and conditions like PCOS, can also contribute to hair loss.
Have you ever noticed that it can feel like you're fighting a losing battle with the scale, even if you're eating healthy and exercising regularly? Well, hormones could be the sneaky culprit behind those stubborn extra pounds. Hormones like estrogen, cortisol, and thyroid hormones play a crucial role in regulating your metabolism and how your body stores fat. So, when these hormones are out of whack, it can make it incredibly difficult to lose weight or even cause you to gain weight, even if you haven't made any changes to your diet or exercise routine. For instance, as women go through menopause and estrogen levels decline, they often experience weight gain, particularly around the abdomen. Estrogen helps regulate metabolism and fat distribution, so when it dips, it can lead to that dreaded belly fat.
Our menstrual cycles can be a bit of a mystery sometimes, right? But those monthly visits from Aunt Flo can actually provide valuable clues about our hormonal health. Heavy or irregular periods, for example, can be a sign that something's off with our hormones. Think about it. Your menstrual cycle is like a finely tuned dance between different hormones, each playing a specific role in regulating the timing, flow, and duration of your period. So, when those hormones are out of balance, it can throw the entire cycle off kilter. Irregular periods are especially common during the first few years after menstruation begins, as well as during perimenopause, the transitional period leading up to menopause. During these times, hormone levels are naturally fluctuating, which can lead to changes in your cycle. Waking up in the middle of the night drenched in sweat is never fun, right? While night sweats can be caused by a variety of factors, like anxiety, medications, or even a stuffy bedroom, they can also be a sign of hormonal imbalances. Fluctuating estrogen and progesterone levels in particular can wreak havoc on your body's temperature regulation, leading to those dreaded night sweats. It's like your internal thermostat is on the fritz. Menopause is a prime time for night sweats as estrogen levels plummet. But other hormonal imbalances like thyroid disorders or even low testosterone levels in women can also contribute to this uncomfortable symptom. Infertility is a heartbreaking struggle that affects many couples, and unfortunately, hormonal imbalances can play a significant role in making it difficult to conceive. Hormones are essential for regulating ovulation, fertilization, and implantation, so when they're out of balance, it can create roadblocks to pregnancy. One of the most common hormonal disorders that can lead to infertility is polycystic ovary syndrome, or PCOS. PCOS disrupts ovulation, making it difficult for an egg to be released and fertilized. But it's not just PCOS. Other hormonal imbalances like thyroid disorders can also interfere with ovulation and fertility. And sometimes, factors like obesity or being underweight can disrupt hormone balance and make it harder to get pregnant.
So, there you have it. 9 common signs that your hormones might be a little out of sync. Remember, our bodies are amazing, intricate systems, and hormones play a crucial role in keeping everything running smoothly. When those hormones are out of balance, it can manifest in a wide range of symptoms, from skin changes to mood swings to reproductive issues. The good news is that hormonal imbalances are often treatable. If you're experiencing any of the symptoms we've discussed, don't hesitate to reach out to your doctor. They can help you figure out what's going on and recommend the best course of action, whether it's lifestyle changes, medication, or other therapies. Thanks for joining me today. Remember, knowledge is power, and the more you know about your body, the better equipped you'll be to advocate for your own health and well-being. Don't forget to like, share, and subscribe for more informative videos.
Welcome to ZenZone Health. Today we're diving into 5 lesser-known symptoms of menopause that many women experience but are not widely discussed. In today's video, we'll explore surprising changes like unexpected body odors, brain fog, strange skin sensations, hair loss, and dry eyes. Stay tuned to learn more about these surprising changes and how to manage them. Let's get started on this journey to uncover the hidden signs of menopause and how to manage them for a healthier, more comfortable experience. Menopause can bring about changes in body odor that many women find surprising and distressing. One of the culprits is the decline in estrogen levels, which affects the pH balance in the vagina. This shift can lead to unpleasant vaginal odors and dryness. Additionally, you might notice changes in your overall body odor, including bad breath. Understanding why these changes occur is the first step in managing them. The drop in estrogen disrupts the natural balance of bacteria in the vagina, leading to an increase in odor. Similarly, hormonal changes can affect the saliva production in your mouth, contributing to bad breath. To manage these odor changes, consider incorporating probiotics into your diet. Probiotics can help restore the balance of good bacteria in your body, reducing odor. Additionally, using mild, unscented soaps for your intimate areas can prevent further irritation and dryness. Hydration plays a crucial role in managing body odors. Drinking plenty of water helps flush out toxins and keeps your body functioning optimally. It's also helpful to wear breathable, natural fabrics. Synthetic materials can trap sweat and bacteria, exacerbating odor issues. If vaginal odor is a persistent issue, consider talking to your healthcare provider. Many women experience memory lapses or difficulty concentrating during menopause, a phenomenon often referred to as brain fog. This can be a frustrating and disorienting experience, making everyday tasks feel more challenging. Brain fog is largely attributed to hormonal fluctuations, particularly the decline in estrogen, which plays a significant role in cognitive function. Estrogen helps regulate neurotransmitters and blood flow in the brain, so its reduction can lead to noticeable changes in mental clarity. Engaging in mental exercises is one of the best ways to keep your brain active and sharp. Activities like puzzles, crosswords, and Sudoku can stimulate your mind and improve cognitive function. These activities challenge your brain, helping to create new neural pathways and strengthen existing ones. Meditation is another powerful tool in combating brain fog. It encourages a state of calm and focus, which can counteract the mental haze. Regular meditation practices can help reduce stress and improve focus. Techniques such as deep breathing and mindfulness can be particularly effective. Physical activity also plays a crucial role in maintaining cognitive health. Exercise not only benefits your body but also your brain. Exercise increases blood flow to the brain, promoting the growth of new neurons and improving memory. It also releases endorphins, which can enhance mood and reduce stress. Aim for at least 30 minutes of moderate exercise most days of the week. This can include activities like jogging, aerobics, or even a brisk walk. Diet can also impact brain health. What you eat can either support or hinder your cognitive function. Foods rich in omega-3 fatty acids, such as salmon, walnuts, and flax seeds, support cognitive function. These nutrients are essential for brain health and can help reduce inflammation. Sleep is another critical factor in managing brain fog. Quality sleep allows your brain to rest and repair. Prioritize good sleep hygiene by maintaining a regular sleep schedule and creating a relaxing bedtime routine. Avoid screens before bed and create a comfortable sleep environment. If brain fog becomes particularly problematic, consider discussing it with your healthcare provider. They can offer additional strategies or treatments to help manage your symptoms. By engaging in mental exercises, practicing meditation, staying physically active, eating a brain-healthy diet, and prioritizing sleep, you can improve cognitive function and navigate this phase more comfortably. Remember, taking care of your brain is just as important as taking care of your body. During menopause, many women experience strange skin sensations such as formication, the feeling of insects crawling under the skin, and increased itchiness. These sensations can be quite distressing and often lead to significant discomfort. These sensations are primarily due to the decline in estrogen levels, which affects collagen production and skin hydration. Estrogen plays a crucial role in maintaining skin health, and its reduction can lead to noticeable changes in skin texture and moisture levels. Formication is a common but often overlooked symptom of menopause. Many women may not even realize that this sensation is linked to hormonal changes and might attribute it to other causes. As estrogen levels drop, the skin becomes drier and less elastic, leading to these unusual sensations. the loss of elasticity can make the skin more prone to irritation and discomfort, exacerbating the feeling of itchiness. Moisturizing regularly is one of the best ways to manage these skin sensations. Using a high-quality moisturizer can help restore the skin's natural barrier and lock in moisture, providing much-needed relief. Using products that contain aloe vera gel can soothe and hydrate the skin, reducing itchiness and discomfort. Aloe vera has natural anti-inflammatory properties that can help calm irritated skin. Staying hydrated is also crucial for maintaining skin health. Drinking enough water throughout the day helps to keep the skin hydrated from within, which is essential for overall skin health. Drinking plenty of water helps keep your skin hydrated from the inside out. Aim to drink at least 8 glasses of water a day, and consider incorporating water-rich foods like fruits and vegetables into your diet. Avoiding hot showers and harsh soaps can also help manage skin dryness. Hot water can strip the skin of its natural oils, leading to increased dryness and irritation. Hot water can strip the skin of its natural oils, leading to increased dryness and irritation. Opt for lukewarm showers instead, and use gentle, fragrance-free soaps to avoid further irritation. If formication and itchiness persist, consider using over-the-counter antihistamines or topical treatments to provide relief. These can help reduce the sensation of itchiness and make the skin feel more comfortable. In some cases, hormone replacement therapy, HRT, may be recommended to manage severe skin symptoms. HRT can help replenish estrogen levels, which may alleviate many of the skin-related symptoms of menopause. HRT can help balance hormone levels and alleviate a range of menopausal symptoms, including skin changes. It is important to discuss this option with your healthcare provider to understand the potential benefits and risks. Discuss the potential benefits and risks of HRT with your healthcare provider to determine if it's a suitable option for you. Your doctor can help you weigh the pros and cons and decide on the best course of action. By moisturizing regularly, staying hydrated, avoiding hot showers and harsh soaps, and seeking appropriate treatments, you can manage these symptoms effectively. Taking these steps can help you maintain healthy, comfortable skin throughout menopause. Hair loss and thinning are common concerns for many women going through menopause. The decline in estrogen and the rise of androgens can lead to noticeable changes in hair texture and volume. Understanding the hormonal basis of hair changes is essential. Proper scalp care is crucial for maintaining healthy hair. Regularly massaging your scalp can stimulate blood flow and promote hair growth. Incorporating biotin-rich products into your hair care routine can also be beneficial. Biotin, a B vitamin, supports hair health and can help strengthen hair strands. Natural remedies like coconut oil can also support hair health. Coconut oil has moisturizing and antimicrobial properties that can protect the scalp and hair. Diet plays a significant role in hair health. Foods rich in vitamins and minerals such as leafy greens, nuts, seeds, and lean proteins can support hair growth. If hair loss becomes severe, consider seeking professional advice. Dermatologists and trichologists can offer specialized treatments and interventions to address hair thinning and loss. In some cases, hormone replacement therapy, HRT, may be beneficial for managing hair changes. By understanding the hormonal influences, practicing proper scalp care, using biotin-rich products and natural remedies, maintaining a healthy diet, and seeking professional advice when needed, you can support your hair health and feel more confident. Menopause can cause dry, itchy, and irritated eyes due to reduced moisture production. This is a common issue that many women face as they age, and it can significantly impact daily comfort and vision quality. Hormonal changes during menopause affect the tear glands, leading to decreased tear production and dry eyes. The reduction in estrogen levels can disrupt the balance of tear production, making it harder for your eyes to stay lubricated. One of the simplest ways to alleviate dry eyes is to take regular breaks from screens. Prolonged screen time can strain your eyes and reduce the frequency of blinking, which is essential for spreading tears evenly across the surface of your eyes. The 20-20-20 rule is a helpful guideline. Every 20 minutes, take a 20-second break to look at something 20 feet away. This practice helps reduce eye strain and encourages blinking, which can help keep your eyes moist. Using artificial tears or lubricating eye drops can provide immediate relief from dryness. These products are designed to supplement your natural tears and can be used several times a day as needed. These products mimic natural tears and help keep your eyes moist. They come in various formulations, so you might need to try a few different types to find the one that works best for you. Wearing glasses instead of contact lenses can also help manage dry eyes. Contact lenses can sometimes absorb moisture from your eyes, exacerbating dryness and discomfort. Contact lenses can exacerbate dryness and discomfort, especially during menopause. Switching to glasses can reduce irritation and provide a more comfortable experience for your eyes. Humidifying your living space can make a big difference in managing dry eyes. Dry indoor air, especially in winter or in air-conditioned environments, can worsen eye symptoms. Dry indoor air can worsen eye symptoms, so using a humidifier can add moisture to the air and reduce dryness. Aim to keep indoor humidity levels between 30% and 50% for optimal comfort. Staying hydrated is essential for overall health, including eye health. Drinking plenty of water helps maintain the moisture balance in your body, including your eyes. Drinking plenty of water helps maintain the moisture balance in your body, including your eyes. Aim for at least 8 glasses of water a day to ensure your body stays well hydrated. If dry eyes persist despite these measures, consider consulting an eye care professional. They can provide a thorough examination and determine if there are underlying issues contributing to your symptoms. They can evaluate your symptoms and recommend additional treatments, such as prescription eye drops or punctal plugs to retain moisture. These treatments can offer more targeted relief and help manage chronic dry eye conditions. By taking regular breaks from screens, using artificial tears, wearing glasses, humidifying your living space, staying hydrated, and seeking professional advice when needed, you can alleviate dry eye symptoms and maintain eye health. These steps can help you manage your symptoms effectively and improve your overall quality of life. Thank you for watching ZenZone Health. We hope this video has provided you with valuable insights into the lesser-known symptoms of menopause. Understanding these symptoms and knowing how to manage them can make a significant difference in your quality of life during this natural transition. Don't forget to like, subscribe, and hit the notification bell for more health tips and information. Embrace the change and take care of your health. By staying informed and proactive, you can navigate menopause with confidence and ease.
Let's talk about your thyroid, a small gland in your neck shaped like a butterfly. It might be small, but it plays a huge role in your overall health. The thyroid produces hormones that control your metabolism. When your thyroid is working correctly, you probably don't even think about it. But when it's off, it can throw your whole system out of whack. Thyroid disorders are more common than you might think. They can affect anyone, regardless of age or gender. These disorders boil down to 2 main types: hypothyroidism and hyperthyroidism. The good news is that thyroid disorders are treatable. With proper diagnosis and treatment, you can manage your condition effectively.
Hypothyroidism is like hitting the brakes on your metabolism. When your thyroid isn't producing enough hormones, everything slows down. It's like your body's engine is running low on fuel. You wake up feeling sluggish, even after a full night's sleep. You're dragging yourself through the day, lacking energy. Your thinking feels foggy, and you're having trouble concentrating. These are classic signs of hypothyroidism. It can also affect your mood, making you feel down. You might notice changes in your appearance, like dry skin and thinning hair. Some people even experience weight gain. Hypothyroidism is more common in women, especially as they age. If you're experiencing any of these symptoms, talk to your doctor. Early diagnosis and treatment are key to managing hypothyroidism.
Let's break down the common symptoms of hypothyroidism. Keep in mind that these symptoms can be subtle, especially in the early stages. You might not experience all of them, and they can vary from person to person. Fatigue, feeling tired all the time, even after a good night's sleep. Weight gain, putting on weight without changes in diet or exercise. Sensitivity to cold, feeling cold even when others are comfortable. Dry skin and hair. Your skin might feel rough, itchy, or flaky. Hair can become dry, brittle, and prone to breakage. Constipation, having infrequent bowel movements or difficulty passing stools. Depression, feeling sad, hopeless, or lacking interest in things you used to enjoy. Muscle aches and weakness, experiencing muscle cramps, pain, or weakness. Slowed heart rate. Your heart rate might be slower than usual. If you notice any of these symptoms, don't hesitate to talk to your doctor. A simple blood test can determine if you have hypothyroidism.
Now let's shift gears and talk about hyperthyroidism. If hypothyroidism is like hitting the brakes on your metabolism, hyperthyroidism is like slamming on the gas pedal. Your thyroid produces too much hormone, sending your metabolism into overdrive. Imagine your body as a car running at full speed all the time. You might feel restless, jittery, and unable to relax. Your heart races, even at rest. You might find yourself sweating more than usual, even when it's not hot. These are all classic signs of hyperthyroidism, but that's not all. Hyperthyroidism can also lead to weight loss, even if you're eating more than usual. You might feel anxious, irritable, and have trouble sleeping. Your eyes might feel gritty or bulge slightly. Just like hypothyroidism, hyperthyroidism can affect anyone, but it's more common in women. If you're experiencing any of these symptoms, it's crucial to get checked by your doctor. Early detection and treatment are essential to prevent complications and get your body back to a healthy balance.
Section 5. Spotting the symptoms of hyperthyroidism. Here's a closer look at the common symptoms of hyperthyroidism. Rapid heartbeat. Your heart might race or feel like it's pounding in your chest. Weight loss. Losing weight despite increased appetite. Feeling hungry all the time even after eating. Heat intolerance. Feeling hot and sweaty even in cool temperatures. Tremors. Experiencing trembling or shaking in your hands or fingers. Anxiety and irritability. Feeling restless, nervous, or easily agitated. Difficulty sleeping. Having trouble falling asleep or staying asleep. Changes in bowel movements. Experiencing more frequent bowel movements or diarrhea. If you're experiencing any of these symptoms, don't ignore them. Schedule an appointment with your doctor to discuss your concerns and get tested for hyperthyroidism.
Section 6. Understanding the causes of thyroid disorders. So, what causes these thyroid imbalances in the first place? Well, it's a bit of a complex answer, and sometimes we don't have a clear-cut reason. But let's explore some of the common culprits behind thyroid disorders. One of the major players is autoimmunity. Autoimmune diseases occur when your immune system, which normally protects your body from invaders, mistakenly attacks your own tissues. In the case of thyroid disorders, your immune system can target the thyroid gland, leading to either hypothyroidism, Hashimoto's thyroiditis, or hyperthyroidism, Graves' disease. Lifestyle factors can also play a role. Chronic stress, for example, can wreak havoc on your hormones, including those produced by your thyroid. Nutrient deficiencies, particularly iodine deficiency, can also contribute to thyroid problems. Iodine is essential for thyroid hormone production, so not getting enough can lead to hypothyroidism. Other factors that can affect your thyroid function include certain medications, radiation exposure, and even genetics. If you have a family history of thyroid disorders, you might be at increased risk.
Section 7. Early detection, your best defense. We've covered a lot of ground about thyroid disorders, and I want to emphasize the importance of early detection. Catching these conditions early is crucial for effective treatment and preventing complications down the road. The good news is that diagnosing thyroid disorders is relatively straightforward. A simple blood test can measure your thyroid hormone levels and determine if your thyroid is functioning properly. Your doctor will assess your symptoms, medical history, and the blood test results to make a diagnosis. Don't wait for your symptoms to become severe before seeking medical attention. If you're experiencing any of the symptoms we've discussed, even if they're mild, talk to your doctor. Early detection and treatment can make a world of difference in managing your thyroid health.
Section 8. Taking charge of your thyroid health. While some factors that contribute to thyroid disorders are beyond our control, there are steps you can take to support your thyroid health. Eat a balanced diet. Focus on nutrient-rich foods, including fruits, vegetables, lean proteins, and whole grains. Get enough iodine through iodized salt or iodine-rich foods like seaweed, fish, and dairy products. Manage stress. Chronic stress can disrupt hormone balance. Explore stress-reducing techniques like yoga, meditation, or deep breathing. Get enough sleep. Aim for 7 to 9 hours of quality sleep each night. Exercise regularly. Engage in at least 30 minutes of moderate intensity exercise most days. Listen to your body. Pay attention to any changes and seek medical advice if needed. By making healthy lifestyle choices, you can support optimal thyroid function and live a long, healthy life.
Welcome back to Zen Zone Health, your go-to channel for practical health advice that empowers you to take control of your well-being. Today we're diving into a topic that's incredibly important, potentially life-saving, and often misunderstood: stroke. Specifically, we're going to uncover 10 unusual stroke signs that are particularly important for women to recognize. Remember, knowledge is power when it comes to your health, so make sure to subscribe and hit the notification bell so you don't miss out on future health tips and insights.
You know how we always talk about the classic stroke symptoms, the drooping face, arm weakness, and speech difficulties? These are the signs that most people are familiar with and can easily recognize. Well, sometimes stroke can manifest in less obvious ways. These subtle signs can be just as dangerous and need immediate attention. One of these is sudden confusion or trouble speaking. This can come on very quickly and without any warning. Imagine having a conversation 1 minute and the next you're struggling to find the right words or understand what someone is saying. It can be incredibly frightening and disorienting. This can be a sign of aphasia, a condition that affects language processing in the brain, often due to a stroke. Aphasia can make it difficult to speak, read, write, or even understand language. It's crucial to recognize that stroke can disrupt the intricate pathways in our brain that control speech and language. These pathways are essential for our ability to communicate effectively. When blood flow to areas responsible for these functions is compromised, it can lead to difficulty expressing oneself or understanding others. This disruption can have a profound impact on daily life. If you or someone around you experiences this sudden change, don't brush it off. Seek medical attention immediately. Early intervention can make a significant difference in outcomes and recovery.
We've all had hiccups, those annoying involuntary spasms of our diaphragm. But did you know that persistent or severe hiccups, especially if they come out of nowhere, can be a sign of something more serious like a stroke? It might seem strange, but stroke can affect the brainstem, the control center for many vital functions, including breathing and the reflex that causes hiccups. When a stroke occurs in this area, it can disrupt these signals, leading to persistent hiccups. It's like a glitch in the system. Now, I'm not saying that every case of hiccups means a stroke. That's definitely not true. But if you experience sudden, intense, or prolonged hiccups, especially along with other unusual symptoms, it's crucial to get it checked out.
We all experience fatigue from time to time, especially in our busy, fast-paced lives. It's normal to feel tired after a long day at work or after a strenuous workout. However, there's a difference between regular tiredness and feeling completely wiped out. But when you suddenly feel overwhelmingly weak, like you can barely lift your arms or walk across the room, it's not something to ignore. This kind of fatigue can hit you out of nowhere, making even the simplest tasks feel impossible. This kind of sudden, unexplained weakness can be a sign of stroke, particularly in women. It's crucial to recognize these symptoms early because timely intervention can make a significant difference. Think about it. A stroke disrupts blood flow to the brain, depriving brain cells of the oxygen and nutrients they need to function properly. Without these essential elements, brain cells begin to die, leading to serious health consequences. This can lead to a cascade of effects throughout the body, including muscle weakness and profound fatigue. Your body might feel like it's shutting down, and you may struggle to perform everyday activities. It's like your body's way of saying, "Something's not right, we need help." Ignoring these signs can be dangerous, so it's important to pay attention to what your body is telling you. So, if you experience this sudden, debilitating fatigue, don't try to push through it. Resting might not be enough, and pushing yourself could make things worse. Listen to your body and seek medical attention. Contact a healthcare professional to discuss your symptoms and get the help you need. Early diagnosis and treatment can prevent further complications and improve your quality of life. We usually associate nausea and vomiting with a stomach bug or food poisoning, right? But these can also be signs of a stroke, especially when they come on suddenly and without an obvious cause. Here's why. The brainstem, which as we discussed is often affected by stroke, plays a crucial role in controlling nausea and vomiting. Additionally, Stroke can affect the cerebellum, the part of the brain responsible for balance and coordination, leading to dizziness and vertigo, which can also trigger nausea and vomiting. So, if you experience these symptoms suddenly and intensely, and especially if they're accompanied by other unusual signs, it's crucial to seek medical attention immediately.
We all know that shortness of breath can be a sign of various respiratory issues, but it can also be a warning sign of stroke. You see, the brainstem, which as we've discussed is often affected by stroke, is responsible for controlling our breathing. When a stroke occurs in this area, it can disrupt these signals, leading to difficulty breathing, rapid breathing, or a feeling of being unable to catch your breath. It's like your brain is having trouble sending the right messages to your lungs. Now, I know that shortness of breath can be caused by many things, but if it comes on suddenly and severely, especially with other unusual symptoms, don't hesitate to call for help.
Seizures are scary, aren't they? They're caused by abnormal electrical activity in the brain, and while they can be caused by various factors, they can also be a sign of stroke. When a stroke occurs, it can damage brain tissue, leaving behind areas of scarring. These scarred areas can sometimes become electrically unstable, leading to seizures. The type of seizure can vary depending on the location and extent of the stroke. Some people may experience convulsions, while others may have more subtle seizures, such as staring spells or brief periods of confusion. Regardless of the type of seizure, it's essential to seek immediate medical attention. Pain is our body's way of telling us that something is wrong, right? It's a signal that something needs our attention, a warning that we should not ignore. And when it comes to stroke, pain can manifest in unusual and unexpected ways. While a sudden severe headache is a well-known stroke symptom, stroke can also cause pain in other parts of the body, such as the face, arms, or legs. This is often due to damage to the brain's sensory pathways, which are responsible for transmitting pain signals. The pain can be constant or intermittent, and it can range from mild to severe. It's important to remember that pain is subjective, and what one person considers unbearable, another person might tolerate. So if you experience any sudden, unusual pain, especially if it's accompanied by other stroke symptoms, don't dismiss it. Get it checked out. Early detection and treatment can make a significant difference in outcomes. Always listen to your body and seek medical advice when something feels off. Pain is not just a nuisance, it can be a crucial indicator of serious health issues. Our sense of hearing is precious, and when it's affected, it can be incredibly disorienting. While many things can cause hearing problems, stroke is one that's often overlooked. You see, stroke can affect the brain stem, which plays a crucial role in processing auditory information. When a stroke occurs in this area, it can lead to hearing loss, tinnitus, ringing in the ears, or difficulty understanding speech. It's like the brain's ability to interpret sound signals gets scrambled. So if you experience sudden hearing changes, especially if they're accompanied by other unusual symptoms, don't hesitate to seek medical attention.
Fainting, or syncope, is a sudden, temporary loss of consciousness. It happens when there's a decrease in blood flow to the brain, and while it can be caused by various factors, it can also be a sign of stroke. Think about it. A stroke disrupts blood flow to the brain, and in some cases this disruption can be severe enough to cause fainting. Additionally, a transient ischemic attack, TIA, often referred to as a mini-stroke, can also cause brief episodes of unconsciousness. The key takeaway here is that any unexplained loss of consciousness should be taken seriously and evaluated by a medical professional.
Our brain is the control center for our thoughts, emotions, and behaviors, right? So it makes sense that a stroke, which affects the brain, can lead to unusual behavioral changes. These changes can vary depending on the area of the brain that's affected, but they can include sudden irritability or agitation, unexplained mood swings, apathy or lack of interest in things you used to enjoy, depression or anxiety, impulsivity or poor judgment, and aggressive behavior. It's like the stroke has disrupted the delicate balance of chemicals and neural pathways that shape our personality. If you or someone you know experiences sudden, drastic behavioral changes, especially after a suspected stroke, it's crucial to seek medical attention.
Thanks for joining me today on ZenZone Health to explore these 10 unusual stroke signs in women. Remember, recognizing these signs and seeking immediate medical attention can make a world of difference. By understanding the subtle ways stroke can manifest, we empower ourselves to take action and potentially save lives. Don't forget to share this video with your loved ones, and subscribe to ZenZone Health for more empowering health insights. Stay healthy, everyone.
Hi everyone, welcome to ZenZone Health. Today, we're diving into 6 powerful exercises that will transform your body in just 4 weeks. These exercises are specially designed to tone your body, build strength, and deliver noticeable results in no time. If you've been looking for a fitness routine that's both effective and manageable, you're in the right place. These exercises are not only aimed at sculpting your muscles, but also enhancing your overall well-being. They target key areas such as your glutes, thighs, core, and upper body, ensuring a balanced workout that addresses multiple muscle groups. Whether you're a beginner or a fitness enthusiast, these moves will challenge you and help you achieve your fitness goals. So, let's get started. Grab your workout mat, some water, and let's jump into these transformative exercises. Remember, consistency is key. And with dedication, you'll see amazing results in just 4 weeks. Let's do this together. Squats are one of the most effective exercises for targeting your glutes, thighs, and core. They build lower body strength and enhance muscle tone, maintain proper form to avoid injury, and maximize effectiveness. Stand with your feet shoulder-width apart and your toes slightly pointed outwards. Lower your body as if you're sitting back into a chair, keeping your chest up and your back straight. Ensure that your knees do not extend past your toes. Push through your heels to stand back up. Planks are an excellent exercise for strengthening your core, shoulders, and back. They might look simple, but holding a plank position challenges your entire body and helps improve your posture and core strength. Begin by getting into a push-up position, but instead of lowering yourself, hold your body in a straight line from head to heels. Ensure that your hands are directly under your shoulders and your core is engaged to prevent your hips from sagging or lifting too high. Focus on keeping your body as straight as possible, like a plank of wood. Start by holding the position for 20 to 30 seconds and gradually increase the duration as your strength improves. Planks also work your shoulders and arms, providing a full body workout in one simple move. Incorporate different variations, such as side planks or plank with shoulder taps, to target different muscle groups and keep your routine interesting. Remember to breathe steadily and maintain your form throughout the exercise. Push-ups target your chest, shoulders, triceps, and core. They build upper body strength and tone your arms. Start in a plank position with hands slightly wider than shoulder width. Lower your body, then push back up. Keep your body straight, avoiding hip sag. Modify by dropping your knees if needed. Aim for 3 sets of 10 to 15 reps. Chapter 4. Lunges. Lunges are fantastic for targeting your glutes, thighs, and calves. They enhance leg strength and balance, making them an essential part of any lower body workout. To perform a lunge, stand with your feet together and step forward with one leg. Lower your hips until both knees are bent at a 90-degree angle, ensuring that your front knee doesn't extend past your toes. Push through the heel of your front foot to return to the starting position and repeat on the other side. Engage your core to maintain balance and stability throughout the movement. Lunges can be performed in various ways, including walking lunges or reverse lunges, to keep your workouts dynamic and challenging. Incorporate lunges into your routine by aiming for 3 sets of 12 repetitions on each leg. You can add weights to increase the intensity and further challenge your muscles. Lunges not only build strength, but also improve your coordination and flexibility, contributing to overall fitness and well-being. Chapter 5. Bicycle crunches. Bicycle crunches are a highly effective exercise for targeting your abs, obliques, and core. They help define your abdominal muscles and improve overall core strength. To perform bicycle crunches, lie on your back with your hands behind your head and your legs lifted in a tabletop position. Bring your right elbow towards your left knee while extending your right leg out. Then switch sides. Continue alternating in a pedaling motion, ensuring that you twist your torso to engage your obliques. Keep your lower back pressed into the ground and avoid pulling on your neck. Aim for 3 sets of 20 repetitions, focusing on controlled movements and proper form. Bicycle crunches not only tone your abs, but also improve your stability and balance. As you progress, try to increase the speed of your movements while maintaining control. This exercise is a great addition to any core workout, helping you achieve a strong and defined midsection. Chapter 6. Glute bridges. Glute bridges are an excellent exercise for strengthening your glutes, hamstrings, and lower back. They improve hip stability and contribute to a well-rounded lower body workout. To perform glute bridges, lie on your back with your knees bent and your feet flat on the ground. Lift your hips towards the ceiling, squeezing your glutes at the top of the movement. Hold the position for a few seconds before lowering your hips back to the ground. Ensure that you engage your core and avoid arching your lower back. Aim for 3 sets of 15 repetitions, focusing on squeezing your glutes and maintaining proper form. You can add variations such as single-leg glute bridges or placing a weight on your hips for an extra challenge. Glute bridges not only strengthen your muscles, but also improve your posture and stability. Incorporate them into your routine to build a strong and toned lower body. Outro. Consistency is key. Remember, consistency is key to seeing results. These 6 exercises are designed to transform your body, but they require regular practice and dedication. Perform these exercises regularly, maintain a balanced diet, and get proper rest to support your fitness journey. Your body needs time to recover and build strength, so make sure to listen to it and avoid overtraining. Thank you for watching ZenZone Health. We hope you found these exercises helpful and inspiring. Don't forget to like, comment, and subscribe for more health and fitness tips. We're here to support you every step of the way, and we love hearing about your progress and experiences. Share your journey with us in the comments below. See you next time. Keep pushing yourself, stay motivated, and remember that every effort brings you closer to your goals. Together, we can achieve amazing things. Stay healthy, stay strong, and we'll see you in the next video.